the involuntary urine leakage or loss after any exertion or activities. So if you're carrying grocery store bag, if you're doing any activities, carrying your children or your grandchildren and you start leaking, this is stress urinary incontinence. The other type would be urgency urinary incontinence, sudden compelling desire to void. So if you are trying to hold your urine and you can't hold it and you start gushing fluid on your way to the bathroom, this is the urgency urinary incontinence. In the conservative approach, we have modification in the way that people drinks. We go back to the voiding diary. So I can look in this and say, well, you have too much drinking in this situation, you might do this, change in the way you're drinking, change in the type of fluid, and a lot of times this will help a lot. Pelvic floor exercise. The problem is to isolate that muscle, and a lot of times I refer my patient to physical therapy to teach them how to use this particular muscle, which is down there. It's not easy to use. A lot of people come, or patients come, especially women, tell me, I know how to do it. And I do the test in the clinic, they don't know how to do it. And it's very helpful. A lot of patients improves with these two things. 50 to 60% of people would come back and say, I don't need to have anything else. I'm very happy with the results I have now. There are other treatment options, which you hear about slings and injection around the urethra. Injection around the urethra, it's a very nice surgery. It is actually about 10-15 minutes in the clinic under local anesthesia. When you look by the telescope inside the bladder, the problem is the muscle in here is very weak. So it is no resistance, open tunnel. When we do the injection, which we do around the urethra, you see this picture. So we close the tunnel. The problem with that, it's temporary. A lot of studies has been done, and it showed that in about 2 years to 3 years, only 40% success. The whole idea behind the sling is we reinforce the area around the middle of the urethra. So when someone coughs or sneezes, this area moves against the sling and blocks the urethra. It's now considered to be the gold standard, meaning this is #1 surgery for incontinence. And the results up now, it's about 12 years from the first time they had the surgery. It's about 82% durability, which is excellent in the field of urinary leakage. In this type, we have medications for those. We have a big 2 families, Inablex, Visicare, Toviaz, Detropan. It's a big family, about 8 or 9 medications out on the market. They are very beneficial. However, the problem, they have some side effects with dry mouth, constipation, blurred vision, and people would quit taking them over time. So if someone is using the medication and it's not working, and it's proved that he had overactive bladder or urgency urinary leak, Botox can be an option for them. And it is done in the clinic under local. It takes about 15-20 minutes. But we inject it all over the bladder in a certain way, so you have the response with that. The other treatment option would be the InterStim, which is a pacemaker of the bladder, basically. It's very small, it's about 1/4 size, and we put it under the skin and the buttocks, so you don't feel it unless you mush hard in this area. What do we need to learn today? Urine leakage is not normal. If you have a urine leak, this is an abnormal condition, inconvenient, and you need to talk to your doctor about it. Sometimes minimal approaches, minimal things, changing your diet, changing the way you drink fluids can make the ultimate benefit for you. Your treatment is there, it's just you need to reach up to it